My name is Madeline Garner, and for my vascular case study, I did it on varicose veins. So varicose veins, the pathology of them is that they are widened, tortuous veins that are easily visible towards the surface of the skin. Varicose veins can appear anywhere on the body, but are most common on the lower extremities. I thought this was a good diagram. On the left, it shows what a normal vein with normal blood flow and normal working valves look like. And then on the right, it shows what a varicose vein it looks like with abnormal blood flow, the retrograde blood flow, a dilated vein, the deformed valve, the skin is bulging due to the abnormal blood flow, and it has a thin vein wall. Some pertinent information is that varicose veins are more prevalent among women rather than men. It is not a huge difference, but it is notable. High estrogen levels have been seen to play a factor on the prevalence of varicose veins, which may be why it's more common among women. Also, that the high estrogen levels may play a factor as to why it's more common among pregnant women, since it is noted that the estrogen hormone does seem to elevate when one is pregnant. It also has a possibility of worsening with each additional pregnancy. Also, obesity, physical activity level, smoking, and one's lifestyle can play a role in the prevalence of varicose veins, as it does with almost any and all other diseases. The etiology of it is that venous valve failure, venous reflux, chronic venous insufficiency, those can all be the underlying cause of varicose veins. That can result in thin walls and insufficient valves, and that results in the retrograde flow and diastasis. The main pathology related to venous veins, varicose veins, is a structural change of the vessel walls and valves, and those structural changes is due to the venous reflux. And as well, elevated blood pressure may lead to the vessel changes and poorly working valves. So everything's kind of connected in a circle with this. The course of the disease is that for most patients, varicose veins present no symptoms. Sometimes the cause is known, such as when one is pregnant, but sometimes it's hereditary, genetic, one's lifestyle, and unknown. And while some may experience sensations of burning, itching, tingling, and pain at the affected area. Treatment, the first thing to try is lifestyle changes, such as stop smoking, get in shape. There has been very little proof if compression therapy works, such as like compression socks. But if the patient is not seeing results and is still facing pain or cosmetic concerns, surgery is an option. Most of the time it is a laser surgery. Prognosis is that varicose veins may present a few signs of discomfort for some and cosmetic concerns for most. However, they are rarely ever associated with high-risk complications, such as like death or amputation. Those are very rare, hardly ever heard of. The clinical pathway of the differential diagnosis. These differential diagnoses are not the same as varicose veins. Sometimes they are mistaken as it, but they can all take place in association with varicose veins. So telangiectasia, also known as thread, spider, or broken veins. That's probably the most common one to get confused with as varicose veins, is the spider veins. That's what most people think of when they hear it. Lymphedema, deep vein thrombosis. Varicose veins do not typically occur as a result of deep vein thrombosis, but deep vein thrombosis may occur with varicose veins. Cellulitis and stasis dermatitis. Those are all things that could be differential diagnosis of varicose veins. This was a picture of a leg with varicose veins. They're the wider parts in the middle of the calf region. This was just a really ugly leg, I thought. It showed both like spider veins, hyperpigmentation, varicose veins. The feet are super calloused. I mean, it's just not a very healthy leg in general. I really like this one because the doctor lined out the actual vein. It's the one in the middle of the Sharpie. It's bulging, quite large in general. So I thought this was quite a prominent case of varicose veins. This one shows a difference between like spider veins is on the left. That one's more just like the visible bluish vein tint. Then the varicose veins, which is the ones that's raised up on the skin. The edema, hyperpigmentation, and ulcers. These are all just like different differential diagnoses that could take place. And then, in conclusions, that varicose veins are tortuous texturous veins that are easily visualized on the skin's surface. They're caused due to weak blood vessel walls and valves. Other than for cosmetic concerns, there are no association with any significant health risk complications. And this one, this photo shows just the varicose veins and spider veins, kind of like how they're different structure-wise as well, with the normal blood flow and abnormal. And these are my references. Thank you.